So recently, the University of Colorado School of Dental Medicine switched to our Articulator system the summer of 2019, just this last August. And we are now going to begin to use the Denar Mark 330. When you get your Mark 330 in your box, it's going to come with this technical sheet. It has a square scan thing here, and you can get the instructions on how to use it. The instructions look something like this. So I'll explain some specific features of the Denar Mark 330 and why we got this tool. It has multiple features that we like. The first feature that we really like is a very robust lock-in, central locking device. Clicks in real nicely. It doesn't break down. It's not plastic. If we wanted to move our articulator, you can release the central locking device, and with the elastics in place, you can move this side to side and forward and back. If you take off the rubber pieces, it now becomes a separable element. Once again, condyles are on the mandibular element, the lower element, and the condyle boxes or fossa boxes are on the upper element, just like a regular joint. This articulator has a custom incisor guide table that can be exchanged for a mechanical table, which I'll show you how to do. It also has a cast T-bar or cast holder, face bow holder. So when you mount your face bow, it can hold the bite fork right here. It has a universal mounting plate that you will probably use in certain classes to mount cast arbitrarily. It has very tight magnetic mounting plates. You may have to use an instrument to remove those. Custom incisor guide table with a rounded tip is the one that you'll use to make a custom incisor guide table. This is removable. The articulator also comes with a articulator stand. It's incorporated into the unit. It can be locked into place so it can't move. This allows you to flip the articulator open and it won't fall off. So if you're going to mount your casts, it's a lot easier to mount them flat. When you put it back together and you're going to put the articulator pin back, you got to make sure you release the lock and then fold it down so you don't break it off. It has an incisor guide pin that is removable, and it's adjustable. Make sure you keep these little spacers that it has. It's important. The adjustability is on a curve, incisor guide pin mount, which means that no matter what position you move this incisor guide pin, the tip of the pin stays in the same area. That's real important. With a mechanical table, if I can get it off of there, pretty tight, just keep wobbling, it'll come off. You put your mechanical table on. The mechanical table has 3 knobs on it. This knob right here releases the anterior-posterior dimension of the table and locks it in at a certain degree angle that you determine by a protrusive record. It has lateral wings that you can set based upon your cast mounting. You dial this knob here, it changes the lateral wing on the contralateral side. Like so. It also has a 45-degree angle so that when you want to look at your case, you can lean this back. I'll put a case on here real fast, maybe. And then you can lean that back, and now you can study your casts. The intercondylar distance of this is based upon historical data. The intercondylar distance is 110 millimeters from here to here. It's about a 4-inch measurement. Very common in most semi-adjustable articulators. You see that the bended angles here and here are preset at 15 degrees. So the semi-adjustable articulator, you have the ability to do a protrusive record, and you can use this red knob right here to adjust the condylar inclination customly or individually for your patient. That way when you're checking their occlusion, you have a replica of their condylar inclination.